Dr. Rob Hicks is here for the first time this year. Happy New Year to you, sir.
And to you too.
Let's talk about the flu. We hear a lot in the media. Is there an epidemic in the UK?
Well, we haven't reached epidemic levels as yet, and in fact the figures released this afternoon suggest that the number of cases may be levelling out. We have to take into account that that might be influenced by the fact that we've had a Christmas and New Year break where surgeries haven't been open full time. So hopefully maybe we'll see the peak soon and then levels will dwindle.
Is there a shortage, though, of inoculations? We keep hearing that the supplies are running dry.
There are some practices around the UK that have run out of vaccinations, although other practices seem to have spare. But what's very important is that we've heard this afternoon that the Prime Minister, David Cameron, has said we can make use of the stockpiled swine flu vaccinations that were being kept back in case there was a pandemic to try and fill any gaps. What's very important is that those people in the at-risk groups, we're talking about the over 65s, those people with long-term health problems like diabetes, heart disease, lung disease like asthma and other medical conditions, those people who are vulnerable to the complications of the flu are prioritised. They're first in line to get the flu jabs and they're encouraged to come forward and get these vaccinations.
So they're rightly at the front of the queue. Should I want one, for example, I'm not in one of those at-risk groups, can I get one?
Those people who are not in the at-risk groups will be encouraged to seek those vaccinations privately, and we know that high street pharmacists are offering those at a relatively reasonable price. What is important is that well, healthy people who are not in the at-risk groups don't go to the GPs and say, look, I'd like it, because really, as we've said, these vaccinations, those that are available, should be made a priority to the people in the at-risk groups first of all.
So above and beyond the vaccinations then, what can we do to help prevent falling ill?
Well, it's not just, as you say, about vaccinations. I mean, we can do things like, we need to be washing our hands regularly throughout the day because the flu virus can survive on hard surfaces. We should clean those surfaces, taps, door handles, computer keyboards, phones and the like. If you're out and about and you haven't got access to soap and water, then an alcohol hand gel is perfect. If you're coughing and sneezing, please, 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 I know it sounds, like teaching children, but go into a disposable tissue and get rid of that as fast as you can, and then wash your hands. If you haven't got a disposable tissue, into the crook of your arm, so you're not spraying this virus around where other people around you might become infected.
Some people are sceptical about the jabs, aren't they? Martin on Forces News Facebook page: I used to suffer badly having the flu jab. After having the jab, since I stopped having it, no flu or colds whatsoever. What does that tell us?
We hear that quite a lot. I mean, the reality is the flu vaccination doesn't contain a live virus. It contains a killed version of the virus, so it can't actually give you the flu. But many people report falling ill afterwards as a coincidence, that they were brewing another type of infection at the same time as they had their flu jab. So be reassured, flu jab is safe and it's effective.
Obviously the weather's pretty prepared for it now, really. What about elsewhere in the force as well? Just have a listen to one of the chief medical officers in Akrotiri about how they're preparing for it with the better weather over there.
I think when people feel better, they can tolerate things better. When the sun's shining, everything feels better. When people are spending a lot more time outdoors, they're less likely to pass the bug on because they're not in such close contact with other people, and that's one of the reasons why it doesn't seem to be so much of a problem here. But still, if it arrives, it will spread around the community, and those at risk will get it.
I guess the point there is that people, particularly in the forces, move around.
And indeed, those who've been on leave to the UK, maybe returning, could be bringing the flu infection back with them. So it's important, again, if you're in a high-risk group, make sure you've had your flu jab and practice the good hand hygiene. Make sure that you wash your hands regularly, that you're coughing and sneezing, if you do cough and sneeze, into a disposable tissue. You get rid of that as soon as possible and wash your hands. And of course, look after your immune system as best you can.
On that point, Chris in Germany, I've had the flu here in Germany, pain head to toe, sickness, weakness from the knees down. He goes on and on and on. Sympathies for everybody, I guess.
Yeah, I mean, there is no cure for the flu. It's rest, liquids, some relieving treatments like paracetamol, ibuprofen. Thankfully, the majority of people get better very quickly and make a full recovery.
OK, yeah, Dr. Rob Hicks, thank you very much for joining us as ever.